At some time in your firefighting career, you will most likely encounter a victim contaminated by hazardous material and be called upon to assist. One area of the decontamination process that requires special attention is how to properly handle contaminated victims. If victims exposed to hazardous materials or WMD are treated only as routine casualties, a serious secondary emergency can be created. The consequences of such a secondary emergency are: victims may experience greater effects from prolonged chemical exposure. Response and hospital personnel will be contaminated by the victims, and the transport vehicles and medical facilities used for victims will become contaminated. Hospitals will not admit a contaminated victim and may not have the resources to do decon themselves. Medical equipment and facilities can cost thousands of dollars to decontaminate, and they will be out of service until decontaminated. To help you avoid these consequences, this program will present ways to properly decontaminate, handle, and safely move contaminated victims. The learning objectives are to show how victims become contaminated at hazardous materials incidents, to present the symptoms of exposure to certain hazardous materials, to outline pre-decontamination procedures, to demonstrate decontamination procedures for ambulatory victims, to demonstrate decontamination procedures for non-ambulatory victims, and to outline post-decontamination procedures. Contamination may not be obvious upon your arrival at a scene, and you should expect that any incident could involve hazardous materials and victim contamination. Victims can become contaminated by hazardous materials in solid, liquid, or gas form, and from chemical, WMD, and radiation sources. Solid materials can cling to the victim's clothing and skin, and can be absorbed into the body through the eyes, skin, and by inhalation or ingestion of dust or powder. Liquids can also adhere to or be absorbed by clothing or skin, and can be inadvertently ingested or rapidly absorbed through the eyes or skin. Gaseous materials are harmful if or when inhaled, and in some instances may be absorbed into the body. Calcium hypochlorite, a corrosive chlorine-based chemical used in swimming pool maintenance, can cause exposure in all three states of matter: solid, liquid, and gas. As a solid in powder form, the product or its dust may burn the skin and eyes and irritate the lungs if inhaled. The chemical can also react with moisture on the skin or in the respiratory tract, producing hydrochloric acid and causing severe burns. The longer the period between exposure and decontamination, the greater the severity of the burns. Also, an increase in respiratory rate and body heat caused by exertion and stress can cause an increase in absorption. When calcium hypochlorite comes in contact with water, it creates chlorine gas that is especially harmful when confined to a small enclosed area. Response personnel must move quickly to remove the victim from the source of exposure or contamination. It is crucial to remember that when chemicals are mistakenly released, they can change form and can cause damage within minutes. Be prepared to handle the effects of each form. The symptoms of exposure to hazardous materials are many and varied. Because the symptoms of exposure to many chemicals are often similar, knowing the exact product involved is crucial. Use your emergency response guidebook to assist with product and responder safety information. Always respond to the worst-case scenario. Assume the victim has been exposed to the most hazardous substance at the scene and act accordingly. A victim who is conscious will usually be aware of the symptoms caused by the hazardous material. Victims will not feel the effects of certain toxins, however, such as pesticides that act as cholinesterase inhibitors, which block the transmission of nerve impulses in the brain. In such an incident, it is recommended that all victims and response personnel have a blood gas analysis to rule out contamination. The concentration of the product is also important. Certain chemicals may only be irritating in low concentrations, but may be fatal at a higher concentration. Similarly, exposure for only a few seconds to some chemicals can cause serious harm, including permanent irreversible injuries. Chemical exposure symptoms often resemble those of the flu, heat prostration, or smoke inhalation. Symptoms may follow the acronym SLUDGEM, denoting the following symptoms: salivation, lacrimation or tearing, urination, defecation, gastrointestinal upset, emesis or vomiting, meiosis or pupil constriction, and muscle twitching. Note whether victims complain of dizziness, nausea, stomach cramps, diarrhea, headache, blurred vision, or muscle pain. Other symptoms can include fatigue, profuse sweating, numbness, drooling, and tingling in the hands and feet. Symptoms that require your immediate attention are those that fall within the ABC guidelines: airway, breathing, and circulation. Any symptom that constricts the victim's airway, shuts down breathing, or causes loss of circulation demands prompt action. Other serious poison exposure symptoms include fever, increased rate of breathing, intense thirst, convulsions, and unconsciousness. Use of a reference guide or a poison control service, together with quick identification of the symptoms and product involved, will help you provide rapid care in urgent circumstances.
Assuming command.
All contaminated persons must be subject to proper decontamination, packaging, and transport before receiving hospital services. The objective of proper decontamination, packaging, and transport is to protect the victim, response personnel, ambulance, and hospital from further exposure. Medical transport vehicles and hospitals are extremely vulnerable to the effects of contamination. A small incident can quickly escalate to a disaster if proper protocols are not followed. Protection of responders from contamination is of paramount concern at any incident, and you should consider and avoid secondary contamination risks at all times. When a victim is down, response personnel should assess the feasibility of rescue attempts. Difficult, time-consuming rescues should only be attempted when they can be done safely. Resist the urge to rush in to help and first determine if victim rescue will cause responder contamination, either from the victim or the surroundings. Keep in mind that contamination from hazardous materials could cause serious injury or death to you and others you contact. If you have the UN number or product name, refer to the yellow or blue bordered pages of your emergency response guidebook. Then refer to the orange bordered pages for response considerations. All rescue, recovery, and decon operations should be done wearing the correct level of personal protective equipment. Neoprene, butyl rubber, or Viton gloves with a 15-inch gauntlet are recommended over firefighting gloves. These gloves offer more protection against a wide range of chemicals. In the event of emergency decon where hazardous materials were not anticipated, you may not have decon materials with you or time to set up a decon corridor. Construct a runoff basin if possible, or use a depression in the ground for containment. It is easier to remove contaminated soil or lay a salvage cover down than to remove contamination from pavement. You can also quickly construct a modesty enclosure to provide victim privacy. Ambulatory victims should be directed with voice commands and/or hand signals. You should avoid becoming contaminated by victims. Be aware that because of injuries, disability, or language barriers, a victim may have compromised vision, impaired mobility, disorientation, or seem uncooperative. Vacuum, brush, or wipe all particulates off the victims. Direct ambulatory victims to rapidly remove clothing down to their underwear so you can flush them as quickly as possible. Top to bottom, more is better. Place personal effects in a plastic bag, mark it with the victim's name, and keep it separate from clothing or with the victim. Remember that 80% of contaminants can be removed simply by undressing. Clothing should be stored in plastic bags and tagged for later disposal. Direct patients to close their eyes and mouths prior to dilution, or close the patient's mouth and pinch the nose if the patient cannot do so. Use handheld sprayers to rinse the patient from head to toe, beginning with the face and airway and proceeding to open wounds. The length of rinse time depends on the product involved. Remove as much of the contaminant from the victim as possible and ensure that the ears, hair, armpits, groin, buttocks, and back are rinsed. You may need to use a surfactant such as soap or surgical scrub, as well as brushes and shampoo. All open wounds should be considered contaminated and should be gently flushed with plenty of water. Irrigate eyes continuously if symptomatic, but do not irrigate a ruptured globe. Direct the irrigation stream toward the outer corner of the eye to avoid contaminating the tear ducts. Determine whether secondary decontamination is required. Be aware that radiation decon will include additional procedures and monitoring. In certain emergency cases, decontamination could be initiated while victims are clothed, with thorough decontamination to follow. Clothing removal is preferred, however. Towels and sheets should be used to dry the body and then discarded into a plastic bag or drum for disposal. Distribute disposable clothing such as coveralls, hospital gowns, slippers, or rubber thongs to victims for dressing and warmth. Prepare injured victims for transport once you have completed decontamination. Also, some contaminated victims may self-transport to a healthcare facility. If the site is not able to decontaminate these victims, you may be called upon to do so. Non-ambulatory victims should be moved to the gross decontamination area in the quickest way possible. Vacuum, brush, or wipe all particulates off the victims. Remove the non-ambulatory victim's clothing down to the underwear, cutting where necessary. Shirts in particular should be cut and should not be pulled over the head. Clothing should be stored in plastic bags and tagged for later disposal. Place personal effects in a separate plastic bag, mark it with the victim's name, and keep it separate from clothing or with the victim. Set up containment devices around the victim to catch the runoff. Keep the victim elevated above the containment devices by laying the backboard across stands or chairs. Close the patient's mouth and pinch the nose if the patient cannot do so. Use handheld sprayers to rinse the patient from head to toe, beginning with the face and airway and proceeding to open wounds. The length of rinse time depends on the product involved. Remove as much of the contaminant from the victim as possible and ensure that the ears, hair, armpits, groin, buttocks, and back are rinsed. You may need to use a surfactant such as soap or surgical scrub, as well as brushes and shampoo. All open wounds should be considered contaminated and should be gently flushed with plenty of water. Irrigate eyes continuously if symptomatic, but do not irrigate a ruptured globe. Direct the irrigation stream toward the outer corner of the eye to avoid contaminating the tear ducts. Direct contaminated water away from the victim. Rinse the backboard or other transport device before transferring the patient to the cold zone, unless you'll be moving the patient to a clean transport basin. Determine whether secondary decontamination is required. Be aware that radiation decon will include additional procedures and monitoring. In certain emergency cases, decontamination could be initiated while victims are clothed, with thorough decontamination to follow. Clothing removal is preferred, however. Dry and cover the victim and transfer to the cold zone for patient care. Towels and sheets should be used to dry the body and then discarded into a plastic bag or drum for disposal. Prepare injured victims for transport once you have completed decontamination. A single-use body bag is useful as a patient transport barrier device for a victim who cannot be fully decontaminated due to medical emergency. If the situation requires it, you may use a specially designed patient pack that will allow oxygen or IV fluids to be administered during transport. If you have a label or a container from the product, seal it in a plastic bag and send it with the victim to assist in treatment. Self-sealing bags and specialty packaging kits are useful and convenient. Alert the transport crew and receiving hospital of the condition and number of victims involved, as well as the product name and chemical properties. Identify the patient as a hazmat contamination victim who has been decontaminated. Be aware that emergency medical services personnel are not required to transport a victim who has not been decontaminated, and hospitals are not required to admit them. Familiarize yourself with your department's pre-incident plan with local hospitals, outlining protocol on handling contaminated victims. Hospitals rely on the expertise and guidance of first responders in hazardous materials incidents. Your smooth performance in a systematic, coordinated response will facilitate a safe transition for all involved from the scene of an incident to patient care. By preparing before an incident, you can save time and lives when called upon. In this program, you've seen the basics of handling contaminated victims. You have seen how victims become contaminated. You've seen symptoms of exposure to certain chemicals. You've seen pre-decontamination procedures. You have observed demonstrations of how to properly decontaminate both ambulatory and non-ambulatory victims. And you have seen post-decontamination procedures. Every day, millions of pounds of hazardous materials are produced, transported, and used throughout the world. The probability that someone somewhere will become a victim of exposure to these chemicals is extremely high. Victims of exposure to hazardous materials can become a hazard themselves if they are not properly handled at the scene. Your proper decontamination, packaging, and transport of contaminated victims means that victims will have fewer effects from chemical exposure. Response personnel will be protected from secondary contamination, and medical service facilities will remain clean and in service.